Okay, so this is our first lecture for Anatomy and Physiology 1. And this is the introduction to Anatomy and Physiology. So these recorded lectures go at a pretty quick pace, but it will allow you to pause and rewind, go back, what have you, to be able to review something if you miss something. So realize I'm going to talk at a quick pace, write some things down, but for the most part, you have the opportunity to pause when you need to and go back. There are the objectives. You have those listed. Okay. Anatomy means the study of the structure of the body. When broken down, it means to cut away. An example would be the heart is a muscle, so that's talking about the anatomy. This is the structure. Has 4 chambers, also anatomy because it's talking about the structure, and it's found in the thoracic cavity. Notice in there, there's nothing that talks about what the heart does. Physiology is the study of the function of the body. So the example here is the heart pumps blood to the entire body. Okay, so this is talking about what the heart actually does, what its purpose is. Here's some practices. First, kidney is the size of your fist. Notice there's no real verbs in there for a function. It just talks about what it is. So the size, so that's anatomy. Second one, stomach produces hydrochloric acid. So that's what the stomach does. So it produces it, so that's physiology. Spinal cord is in the spinal column. We talk about where it is, anatomy. And this last one, human brain tastes like chicken. Take some time to digest that, pun intended. Okay, this one doesn't talk about the human brain doing anything. It just talks about what it tastes like. So that's what it's made of. What it's made of is what makes it taste like that. So that is anatomy. Organization of the human body. We're going to talk about that the human body is made up of atoms, and we'll get more into this in the next few chapters. And atoms come together to make molecules. Macromolecules are things like proteins, carbohydrates, nucleic acids. These all form the building blocks of organelles. There's many different organelles in a cell. Cells of similar type make up tissues. Tissues have different functions, and they function in making the organ. Organs perform some function within an organ system, and then an organism has many different organ systems. Next slide has some examples of those. So there's those examples. For the test, you're not going to have to know specific examples, but at least be able to identify or talk about how the human body is organized. All right, anatomical terms. We use anatomical terms so that we're consistent, so that everybody knows what we're talking about. You wouldn't want to have doctors at one hospital in one state use different anatomical terms than they would in another state. So we want to be consistent and accurate. You would not be on a call and call in and say that, hey, a patient has a boo-boo on their arm. You want to be accurate. You want to say where it is on the arm, maybe which bone you think is broken, what type of break it is. And what do they do? They tell us what something is, where it is, how it is in relationship to something else, whose it is, and why we're talking about it. When we talk about anatomical terms, we always use anatomical position as a reference. So in anatomical position, you have to stand erect, face forward, arms at your sides with your palms forward. Okay, so that would make your thumbs pointing out away from your body. Heels together and your toes pointed out slightly. So that's anatomical position. Anytime we talk about something, unless we specifically say, talk about a different position like supine, then you have to assume anatomical position. Okay. Location and position terms. Location and position terms are used to relate the patient or subject's body, always in reference to the patient or subject. So when we say right arm, it's the right arm of the patient, not the right as we look at it. There are surgeries that go very badly every year because someone made a mistake with location or position terms. And once again, always assume anatomical position. Okay, position and location terms. We'll start here. We'll start with superior and inferior. Superior and inferior refer to the subject, the whole of the subject. So superior, most superior part of your body is going to be your head, and the most inferior would be your feet. Okay, but we can also have a superior and inferior, like a superior part of your thorax to an inferior part of your thorax. So that we have superior and inferior like that. Proximal and distal, for our purposes, proximal and distal, right now we're just going to talk about them with our extremities. The proximal portion of your body, of your extremity, is closer to the point of attachment. Okay, so that's closer to the point of attachment. So your arm, the most proximal part of your arm is your shoulder, or where it attaches at the shoulder. The distal portion is the portion further from the point of attachment. Okay. We have to relate these to something. You can't just say my proximal arm. You would say that for example, the wrist is distal to the elbow, but the elbow is distal to the shoulder. Okay. Another example, say your knee is proximal to your ankle, but distal to your hip. Okay, another one there, medial and lateral. Medial means closer to the midline. This midline is this imaginary line you have running down the center of your body. So here's the midline. This is the imaginary line you have running down the center of your body. Lateral means further from the midline. So for our example here, say your umbilicus or your belly button is medial to your hip bone. Let's talk about on your face. So you have a face, you have a couple of eyes, a nose, a mouth. Let's do some ears. You can see what 4 years of walking past art school does for you. So in this example of a face, the eyes are medial to the ears. Okay. We really should make our ears like this too. So, okay, that's what your ears look like. Just assume that. So the eyes are medial to the ears because they're closer to this midline. Your nose is medial to your eyes. And look at someone around you right now, or find someone. Ask yourself this, what are the eyes to the ears? They're medial to the ears, but are they superior or inferior? Really, your eyes are pretty much on the same level, so they're neither superior or inferior. Okay? But your nose is superior to your mouth and medial to your ears. So just try to think about that in different contexts and ask yourself different questions. Okay, I have to add two other ones here. We have ipsilateral and contralateral. I'm actually going to open up another page for that. Okay, so ipsilateral means on the same side. So your left arm and left leg are ipsilateral. Contralateral means on opposite sides. Okay, so your left shoulder and right shoulder are contralateral. Another way to say that would be bilateral. Okay, you have your kidneys are bilateral because they're on both sides. Okay, but your left leg and right arm are contralateral. They're on opposite sides. Okay, more position terms. We have anterior and ventral. Okay, anterior and ventral mean the same thing. We're talking about humans. Anterior means toward the front. Ventral means towards the front also. These really, anterior and ventral for humans are the same. For a four-legged animal, anterior would be towards the face and ventral would be towards the belly. Okay, so if you have a dog that looks like this, don't make fun of this drawing, the ventral portion would be here and the anterior portion would be there. On the back, we have posterior and dorsal. For the humans, really means the same thing. For a dog, though, this would be the posterior, and this would be the dorsal. Okay. So for humans, anterior, ventral mean towards the front, posterior, dorsal mean towards the back.